How you doing? I'm Big D. Just giving it a second, make sure everything is connected. Hmm. Hey, John.
What's up?
Well, I'm not seeing it anywhere. Um,
Saying
hard to
live
look.
on my side.
It does?
Yep.
Okay, I'm gonna just go for it then.
All right.
Sorry about that, guys. I'm Big D. Welcome to the show, DJT Militia. We have a show about vaccines, and I hope you stick around till the end. It is May 4th, 2024. And we have a guest today, John, aka Propane. I'm going to bring him on. Please welcome John.
Good afternoon, everyone.
John's going to start the show off. He's got something he'd like to share from a previous show about Micron.
Yeah, I was just doing some research and I came up with a few things from a couple different sources and put it together. Thought it was interesting. Last week we were talking about New York and the chip facility Micron's going to put there, and I want to start with actually Saudi Arabia agreeing to continue talks to normalize kingdom with Israel. And the reason why I want to start there on this subject is despite the October 7th attacks in Israel and what's going on in Gaza, uh, some of them talks between the Arab nations and Israel obviously came to a halt because of that. The Abraham agreements and stuff like that. But some of the stuff has still been, they're still talking. They're still having talks on it. And basically, Saudi Arabia is the one doing that, and in concert with the U.S. And I just found it interesting that during these talks, the two things that came up was one, furthering nuclear development and power plants for the kingdom and also for us here in this country. And I found that interesting for one reason, and I'll get right to that in a little bit. The second thing that they're also talking about between the U.S. and Saudi Arabia would be, chip development. And last week we had the story about Micron and chips and stuff like that. And not only them, but like Intel, Samsung, Tesla, TSMC, they're putting a lot of money. I mean, a lot, billions and billions of dollars into the U.S. to make these chips here. And then you have the agreements between the kingdom and talks with them, with Israel, which also ties into nuclear plants and chip development over there. So what I found interesting about it is, due to the failure of no one talking after the October 7th attacks, that over here, the U.S., we have what I call, it's my opinion, the failed New Green Deal with, electric cars being pushed and windmill farms and all that. You would think that any further development in the U.S. would not include more nuclear plants in our country, even though that's, if you're looking at it from the Green New Deal thing, that wouldn't be in part of that, Now, I understand as far as the chip development, you have the CHIPS Act that's, being worked out. And that's basically to have more chips built in this country. But, it almost seems like Biden and them people over there, they're looking to more push development and import chips more than them backing it in the United States. So if you put all them things together, all them things about nuclear power plants in the United States and chip development in the United States so that we can make our own and further, sure sounds pretty far from the Green New Deal, even though they talk about it. So I'm thinking about it. I'm thinking, okay, we have all these companies investing billions of dollars into the chip development, and obviously nuclear is a big thing too. That costs billions of dollars to make. None of that, to me, sounds like the new Green Deal. None of that seems like something Biden would do. If you look at all the other things that he's doing as far as, making China and other countries richer. And, so I find it kind of amazing that if you do the timeline for all these things, it's going to fall into the 20 to 2026. Now, these are things, chip development here in the United States and nuclear power over windmills and electric cars. It's something that Trump talks about. So by the time they get all these plants for chips and new power plants, high-paying jobs will come in at the same time or during when Trump's presidency. It's not going to do anything for the Biden economy. I just found that very interesting, how they talk about the Green New Deal. They talk about, getting chips from other countries. But at the same time, there's things happening in our country, companies developing and putting tons and tons of money, millions and billions into chips made here. And same thing with the nuclear power plants. It just sounds strange to me that Biden would have any part of doing that, because that doesn't sound like any of his Green New Deal stuff. So tie that in with all the good paying jobs that them companies are going to bring in the United States. That also doesn't sound like a Biden administration plan, but yet it's happening. So that always brings me back to think, the talks of normalizing relations with Israel and Saudi Arabia are still somewhat going on. They're doing what they can despite the war over there. The development and the money that's being put in the United States for both nuclear and chips all sounds like a Trump thing. And it's all falling in the years where if he does get back in the presidency, it's going to help Trump's economy and not the president's economy. It just sounds to me that maybe there are things going on in the background that no one knows about, and that maybe Trump has his hand in. Make any sense to you, Dan?
Yes, it does.
You know
And
what I
I'll,
mean?
I'll give you three things that I'm thinking about. And thank you for your research. Nothing about the Green New Deal has anything to do with excessive amounts of toxic waste, which those chip plants do, and they produce large amounts of electrical use, which the Biden administration wants to cut back on, and definitely does not sound like anything the Biden administration or the Green New Deal would want. And third, the amount of water use that is going to be needed for that plant. They talk about this huge amount of consumption of electrical and water. So both are what you would consider something that Trump would be, wanting, not the Biden administration, not a Democratic type state like New York.
Right.
So I definitely agree.
Yeah, it just seems very odd that that if anything would happen, like where they're really moving forward with this, and obviously they are because they're talking billions and billions of dollars, it's not going to benefit the Green New Deal or the what's he call the economy thing, Build Back Better, whatever.
Yeah,
By the time they all get up online and all, it'll assuming Trump wins, it's going to benefit that economy, not his economy.
very
Not
true.
not the current economy. And I just said, it just doesn't. You can't talk on one hand about the Green New Deal and talk on the other hand about manufacturing in this country and nuclear power, because it contradicts each other.
Mm-hmm.
You know what I mean? So I found that amazing that them talks and that there are monies, large amount of monies getting together to further that besides what's going on in the current administration. And you tie that in with what's going on with Saudi Arabia. It's kind of strange that they're doing the same thing, nuclear power and chip development. And I put it all together and I'm thinking, something's strange about that.
Yeah, I agree. That's the main reason why China wants to overtake Taiwan. They want
Exactly.
that chip manufacturing.
Right, right. And so going back to what you just said, with the water, they're going to have water resources, more electricity. Well, that sounds like another Trump thing where he wants to, our infrastructure should be 100% in this country, and we know it's not. And in order to
Mm-hmm.
provide plants and such as nuclear and such as chip, that's going to involve environmental things.
Yep.
Right.
And
It's going
where's the new infrastructure for our electrical grids?
Right. You would need
That's
that to
needed.
supply it. Very interesting. So all that work, all the jobs from infrastructure to the electric things, the water things, the chip plants, that's a lot of jobs.
Oh yeah,
You know what I mean?
that's
That's a
gonna
big
be
boost.
huge. And it's
Com-
not a huge city either.
right. And if you compare that to the Biden administration, where he says, "Oh, well, we gained 300,000 jobs last month." Well, you guess what? They were all government jobs. So I don't see how that's helping anything. That's more of your money going down the tube. You know, that's not
Yeah.
hiring electricians, plumbers, bricklayers, blah blah blah, whatever. It's
Mm-hmm.
amazing. So I just wanted to throw that in from last week. It's just a little recap that I add on to what you were talking about last week.
I appreciate that, John.
Thank you.
Okay. Now I have a few things that I want to start with. Well, one thing I want to start with. The only thing I was able to do is bring it up as an audio. I wish I had something more than just an audio of this, but let's see if we can get this up. I apologize. I had it up and then it shut down on me again. Well, I'll start this and I'll find that. This is Dr. Malone, Dr. Robert Malone. I've done some research on his credentials, and he is definitely someone you might want to consider. Take it for a grain of salt, and decide on your own and do some research on Dr. Robert Malone. But I think this is something that you definitely need to hear. I'll bring him up on stage, and here we go.
My name is Robert Malone. I'm a physician and a scientist, but more importantly, I'm a father and a grandfather. I don't usually read from a prepared speech, but this is so important that I wanted to make sure that I got every single word and fact, scientific fact, correct. I stand by this statement with a career dedicated to vaccine research and development. I'm vaccinated for COVID, and I'm generally pro-vaccination. I've devoted my entire career to developing safe and effective ways to prevent and treat infectious diseases. After this, I'll be posting the text of this statement so that you can share it with your friends and family. Here's the thing. Before you inject your child, a decision that is irreversible, I wanted to let you know the scientific facts about this genetic vaccine, which is based on the RNA vaccine technology I created. There are three main issues that parents need to understand before they take this irrevocable decision. The first is that a viral gene will be injected into your parent's cells. This gene forces your child's body to make toxic spike proteins. These proteins often cause permanent damage in children's critical organs. These organs include their brain and nervous system, their heart and blood vessels, including blood clots, their reproductive system, and most importantly, this vaccine can trigger fundamental changes to their immune system. The most alarming point about this is that once these damages have occurred, they are irreparable. They cannot be reversed. You can't fix the lesions within their brains. You cannot repair heart tissue scarring. You cannot repair a genetically reset immune system. And this vaccine can cause reproductive damage that could affect future generations of your family. The second thing you need to know is about the fact that this novel technology has not been adequately tested. We need at least 5 years of testing and research before we can really understand the risks associated with this new technology. The harms and risks from new medicines often become revealed many years later. I ask you to ask yourself, as a fellow parent, if you want your child to be part of the most radical experiment in human history. One final point. The reason they're giving you to vaccinate your child is a lie. Your children represent no danger to their parents or grandparents. It's actually the opposite. Their immunity after getting COVID is critical to save your family, if not the world, from this disease. Finally, In summary, there's no benefit for your children or your family to be vaccinating your children against the small risks of the virus, given the known health risks of the vaccine that as a parent, you and your children may have to live with for the rest of your lives. The risk-benefit analysis is not even close with this vaccine for children. As a parent and grandparent, my strong recommendation to you is to resist and fight to protect your children.
It is
The
definitely.
things that led me initially.
One second. Okay, get rid of that. I'll remove that one. It's an eye opener, but that's not even close to what I have after this. The next screen. Let's see if I can pull this one up. Sorry, I'm dealing with new software, and it should be easily to pull up, but sometimes it takes a minute. Okay. Here we go.
It decreases the ability to produce white blood cells by 50% from your first vaccine. Then 8 weeks later, which is white blood cell reproductive system, so your ability to make another generation of white blood cells is 8 weeks. That's why they set it up 8 weeks later to hit it again. So you hit the white blood cell ability while it's down. So now what you do is now they decrease the saline in the second one, and they increase the harmful ingredients. So now you have a shift in the ingredients. So they decrease the saline and increase. So now there's a shift. And then what they do is that second dose attacks your ability to make white blood cells by an additional 25%. So now you only have a white blood cell ability, like the ability to make white blood cells functioning at 25%. So you just wiped out 75% of your military and the ability to make that military. Then what they do is they set in the booster. The booster has 81 strands of foreign bacteria that your cells have never come across. You don't have the antibodies to fight it. You only have 25% of your white blood cell production to be able to fight it. So it's a losing battle. So then what starts to happen is you start to get chronic inflammation that goes to the areas that you had predisposition. So if you are someone that has gut health issues, that's your area that is going to focus on, and you're going to have inflammation in the gut health. If it's respiratory, if you have tumor or cancer, or if you have, say, endometriosis, or you have a skin condition, whatever that is, it's going to inflame that area because now the body has hit the sympathetic nervous system, which is the fight or flight, and the body is in a chronic inflammatory state with a low immunity and a low immune response. Then you get your second booster. What the second booster has, it has 8 strands of HIV. And now what that does is it completely shuts off your ability to make white blood cells. And if you Google what that disease is, it is HIV. So now we have people that are walking around with no immune system, no ability to make an immune system, 81 strands of foreign bacteria, and then also 8 strands of foreign HIV, along with all the other harmful ingredients, and then they remove all the saline from the first and second booster. Now, to make matters worse, during this process, 20 to 30% of the population is going to die every single series of this process. There's 4 series. They have 3 more boosters that are coming out, and the reason why is because once they make you so that your immune system can't make white blood cells anymore, you become dependent on the boosters to survive, just like someone becomes dependent on insulin. Big Pharma is looking for people that either die off to protect our population control, and then those that don't die off, we will have reoccurring customers for life with the boosters so that they will be able to maintain income and collect the money back from all the funding that they put in to make these vaccines in the first place. So hope that was helpful. I hope that you listened to this properly, and I hope that you take the time to do your own critical thinking and just give it 2 to 3 years. Every single animal that participated.
That is another. It's very shocking. Again, take it for what it's worth. Do your own research, but I have some more coming that will help you understand that it is out there, and more information and reports are coming out in, well, can't say mainstream media, but some of the other outlets. I don't know if you've known anybody that has some kind of rare disease, cancer, very rare, very fast forming cancers, died suddenly, heart issues in the mid 40s, myocarditis, pericarditis, heart issues like that. I might be saying it incorrectly, but Guillain-Barré's disease, which I'm hearing mimics something like polio. I knew a 35-year-old, very healthy young lady. She now will walk with a cane or a walker for the rest of her life. It's she said that she hasn't seen her parents in 6 months, and she doesn't want to give it to them because that's the huge lie that we were given, that you'll be able to not transfer the disease. You won't get the disease, but if you do get it, later on, and they said to you, if you do get it, it's going to be milder. You won't end up in the hospital. And then you find out that majority of individuals that did get it or ended up in the hospital. It just seems like it's just been a huge lie. And I wanted to do another show because I think it's important. A lot of my friends who had received the vaccine will not get the boosters because some of the information is coming out, and even they have received it, which they never believed the word I had to say. It's just shocking. I have more to talk about. I have much more to talk about, so please stay tuned. John, do you want to respond to any of that?
Well, you know what it is for me? I must have spoke so much back in the time during COVID, right before, even in the beginning, to so many people. I did my research. I listened to every side. You have to listen to every side because even if they're lying, there's some truth in it. There's some truth in it. They might be lying. Put that together, listen to scientists and all. They always said, follow the science, and some of that science, common sense, it didn't make sense to me. I have a kind of a problem speaking about this because I spoke about it so much in the past. Lost friends over it. Family members. I think the thing that makes me feel really bad about it is that I did stop trying to inform people. And I stopped only because it was making me sick. And I'll explain that a little bit. Some people that I would talk to back then, oh, I'm going to line up for every shot, every booster there is as soon as it comes out. I go, why? Why? Be it for different reasons, Well, the reason might have been, well, you're not an elderly person in an age bracket that, it may affect you. You have no medical history right now. You don't have nothing medically wrong with you or anything like big that maybe you should get the shot. I think the worst people, and I hate to say it this way, but I mean, I'm sure this doesn't pertain to everyone, but I've noticed it a lot. And if you're watching TV over the last week, you'll notice that a lot. And what that is, it seems the more educated the person is, the more dumber they come when it comes to vaccines.
Yep. Common
Now,
sense.
you know what I mean? You got to use common sense. I mean, we weren't even given the opportunity to let herd immunity take in. It took a lot longer for herd immunity with the wearing of the mask. As far as the vaccine's concerned, you know, I have my theories in the beginning, which ones were good and which ones were going to harm you. Uh, you know, if you're thinking like Trump's warp speed and all that, I, as a president, I really believe he had to do something. He had to do something fast, and he did push everything through. What a lot of people don't speak about that I find very interesting is in the very beginning, who deployed all the vaccines? You know who deployed all the vaccines? The military.
Oh, yeah.
In the very beginning, the military deployed all the vaccines. And then there was a period of time where I was getting the impression by reports that not enough people died. After that, the military was not in charge of distributing the vaccines. There was other distributors by that time. The military was put in first because they had the means. I think them vaccines, now you can call me a conspiracy theorist, you can call me whatever you want. I believe them vaccines were safe or fake vaccines. That's why a lot of people didn't die.
I agree.
When the other transportation means came in down the line by so many different avenues, that's when all these other developments start becoming main news. So when Trump said, I think I saved many millions of lives, I really believe he did. And I believe he did because the initial vaccines were either fake or they were something that were not going to harm you. When it got out of the Army deploying the vaccines is where I think things changed. So I always was in agreement that just because you take the vaccine, you're not going to get sick or you're not going to die from it. I believe it depends on when you took it, what batch you took it, what location you took it. And there's a lot of evidence for that. You know, why some people, the question always came up, why some people are getting sick and some people are not. Well, that's
true.
my answer about that. If you took the early vaccine, you probably are okay because it was probably fake or whatever. You know, if you took the vaccine when the other distributors start distributing it and the military was out of the picture, then you might have a chance of having something wrong with you down the line. Just the fact that we weren't allowed the herd immunity to kick in and the mask suppressing that herd immunity and people getting sick just by breathing their own breath. You know what I mean?
Yep.
Was making people sick. I mean, and it's crazy because, like I said, and I hate to say that, but it seemed like the more the educated person, see, I didn't go to college, but I consider myself educated. You know, when people say, oh, you know, educated, I'm more educated than you, I went to college. Well, that's a bunch of bull. Okay. There's something called common sense. You don't have to be college educated to be intelligent. You know, but common sense. Why would you give it to your child when they had a less than 1% chance of anything happening to them?
They have a much better immunity,
Right.
immune system.
Exactly. Why would you give it to elderly people that are already sick, already have ailments and other things to deal with? Why? So I have I'm a little reserved in talking about this subject because, like I said, friends, family members, They wouldn't listen to me. They thought I was nuts. They thought, So what was their response? Well, I'm not going to speak to him anymore. I'm not going to be near him because I don't want to get sick from him.
Mm-hmm.
And I said, well, wait a minute. Doesn't your mask work? Doesn't your vaccine work?
Mm-hmm.
And now over time, it's a funny thing, but I'm hearing it from, they're not telling me it, but I'm hearing down the grapevine. Who's got problems with their heart? Who's got problems with their veins? Who's got problems with their brain? Who's got all these things that they didn't have before they start taking the vaccines? And they, even to this day, they will not say, well, maybe he was right. And due to them vaccines, this is why I'm having this. And there's many of them, many of my friends, many of my family, like not my immediate family. I'm talking about like cousins, uncles, oh, such and such just had this, such and such had that, something, but you're still running to the pharmacist, aren't you, to get them shots and the boosters one should be enough. Why they keep throwing them in you more and more and more and more, and then
you
there's
only get one flu shot.
And there's other things about vaccines that made me think about it. When I was young, you only needed 1 or 2 vaccinations for your life. You're done. Now these kids that are going into school there's so many things that they have to do. They have to take blood tests. They have to have different vaccinations throughout the years. It's vaccination after vaccination after vaccination. What is going on?
Mm-hmm.
So this didn't all start when COVID came around. This was in the works.
Oh,
10,
definitely.
10, 20, 30 years ago. It just got real crazy when COVID came around. And here's another thing. I'm very fond of animals. Your vets are doing the same thing. If anyone takes their pets to the vet, you'll notice the same thing. Oh, I can't work on your animal until it gets this shot. I can't do it till this shot and that shot and this shot and that booster. We never used to do that before. Dogs and cats, they're healthier than all of us. You know what I mean? So they tested every part of our brain and our thinking and our hearts and all, and even our common sense. And some people fell for it. That's what I got to say about that. It's kind of strange. Here's 2 little things here that I also picked up, and I don't know these are true, so don't hold me to this. But I was reading an article, and it says now some of the side effects. Here's 2, what I thought eye-catching side effects, long-term side effects from vaccination. Easily contagious dementia. So they're not saying that you just got, you might be getting dementia because you took the vaccination. They're saying that you can easily contaminate someone else.
Wow.
Oh, and the other one, now this one kind of makes sense if you think about what's going on for the last year. The shots, side effect, gender dysphoria. Now,
No, that's interesting.
think about that one, and you think about what's going on in the news and what you hear.
Yep.
I don't know. Crazy, or is it true?
Yeah, like I said, do all your own research, guys. What we're saying today, we've both done some research, and that's what we have found. Does not mean it's true, but if you think about it and you can see what's going on in your own area, you're probably more leaning to this is more true than not. All right, I have Dr. Robert O. Young, very, very intelligent doctor. I checked his credentials as well. Very interesting. Other doctors that you might want to look into as well is Dr. Sherry Tenpenny. Very intelligent. Put their lives on the line. May have already lost their ability to be a doctor. I know Dr. Sherry Tenpenny had issues with, they tried to pull her license to be able to practice. And then another incredible lady, Dr. Judy Mikovits. Many of these doctors that I have spoken about have also been on different shows together. Watching what they have to say, I've only been able to get a little bit to share with you, and hopefully these things are going to prepare you a little bit. This is the audio tape that I wanted to share. I tried to make it so it was video, but I could not make it happen. Here we go.
That the biggest fraud against this humanity, our humanity, is the fact that viruses have never been isolated. None. There is no measles virus. And once you understand the basic chemistry and biology of the fraud that they perpetuated on the human race, and each year, if you ever thought about this, why is there a new virus every year with a new name, with a similar types of symptomologies? This all started with the Third Reich and Dr. Enders and the so-called viruses. I write about this in one of my books. A second thought about viruses, vaccines, and the HIV/AIDS hypothesis. And I'm not alone. Those who have been brave enough, who stood up, even Peter Duesberg, Professor Peter Duesberg at Berkeley University, a friend of mine, who wrote the book Inventing the AIDS Virus, lost all of his funding at the university. When the Nobel Prize winner for discovering the so-called HIV virus gets exiled to Beijing because he's changing his mind about the existence of a virus. This is how bad things are.
It makes you might want to consider everything that we've ever been told is unrealistic. This sounds like he definitely knows what he's talking about. So here's some research that's been revealed on the COVID mRNA vaccines. Contain components that suppress the immune response and stimulates cancer growth. A comprehensive review by an international consortium of scientists has raised serious concerns about the COVID-19 mRNA vaccine safety profile. The article summaries of current research on a particular topic. They are also sometimes called literature review or secondary sources. Now, these components that's been introduced in the mRNA vaccines as a means to produce a significant amount of modification or modified SARS-CoV-2 spike mRNA through in vitro transcription, or IVT. This modification was critical in the rapid development and deployment of the vaccine during the height of the pandemic. However, the review article calls into question the long-term impacts of this medication, especially concerning the vaccine interactions with the body's immune response and potential carcinogenic effects. According to the review, the abstract evidence suggests that while mRNA vaccines may have been effective in reducing severe disease outcome, they might not provide sterilization immunity, leaving individuals susceptible to recurring infections. More critically, the review highlights that the inclusion of the mRNA vaccine appears to inhibit key immunology pathways, impairing the body's early interferon signaling. Interferon is a natural substance that helps the body's immune system fight infections and other diseases such as cancer. This immunosuppression intended to ensure efficient synthesis of the spike protein, and minimize immune activation, foster an environmental conducive to cancer development and metastasis. In contrast, mRNA vaccines without this modification has shown the opposite effect. Based on the compelling evidence, we suggest that future clinical trials for cancer and infectious diseases should be used mRNA vaccines with 100% modifications, but rather ones with the lower percentage of modification to avoid immune suppression. Cancer incidence has been rising for 6 of the most common cancers: breast, prostate, and endometrial, pancreatic, kidney, and melanoma. Now, according to RENS, there has been an astronomical increase in several serious illnesses and disorders diagnosed in the U.S. military since the rushed rollout of COVID-19 vaccines, most concern of which cancer, which has seen a 3 times increase. There has been substantial data showing that it's been seen, for example, miscarriages increased by 300% over the 5-year average, almost 300% increase in cancer over the 5-year average. Saw the panel discussion in Washington, D.C. that was hosted by Senator Ron Johnson. Cancer hitting more young people in the United States and around the globe, baffling doctors. Diagnosis rates in the U.S. rose in 2019 to 107.8 cases per 100,000 people under 50 years old, up 12.8% from 95.6 in 2000. Federal data shows a study in the BMJ Oncology last year reported a sharp global rise in cancer in people under 50, with the highest rates in North America, Australia, and Western Europe. The world vaccine appears nowhere in the article. And mindlessly goes on to say that doctors are racing to figure out what is making them sick and how to identify young people who are high risk. They suspect that changes in the ways we live, less physical activity, more ultra-processed foods, new toxins have raised the risk of young generations. Maybe doctors should start focusing on the obvious. It's just amazing. It's mind-boggling how this has not hit the average mainstream media. Here is Japan. Preprint study urges halt on the mRNA vaccines amid blood bank contamination fears. This is my first thing that I was thinking. If someone had the vaccine and I needed a transfusion, would I want to take that chance? Thank God so far I have not needed anything like that, because that in my mind is a problem. at least as far as I can understand. But medical professionals are being urged to consider the potential risks associated with blood transfusions, using blood production from individuals who have experienced long COVID or have been recipients of genetic vaccines. Because these are not, the mRNA are not, from what I have researched, are not vaccines. They are gene therapy. Now, this caution comes amidst growing concerns over the unknown effects such as vaccines may have on blood products and the possible health risk involved. A groundbreaking study published earlier by a team of researchers led by Jun Yuda at the Ashoka Medical University in Japan has ignited a global conversation about the safety of blood transfusions from doctors vaccinated against the COVID-19 with genetic vaccines. Another thing to be concerned with. I do have more. Moderna developing mRNA vaccines for multiple diseases reported linked to the COVID shot. Now you have to remember, Moderna is not the only mRNA vaccine for COVID vaccines. Now, just last week, Moderna announced progress on several mRNA-based vaccines for disease, including many reported links to the COVID-19 shot. The Defender reported that 3 of these shots in question, Epstein-Barr virus, EBV, varicella zoster virus, VZV, chickenpox and shingles, and the norovirus have advanced to pivotal late-stage development. Definitely be aware of that and be concerned before taking any vaccines without doing your research. That is only my opinion. Moderna has revealed that their announcement that the U.S. Food and Drug Administration will likely approve its respiratory syncytial virus, RSV, vaccine, the mRNA 1345, for older adults. The Defender reports that this is part of an expected $52 billion market for Moderna's infectious disease vaccines. Again, be aware that this is coming from a company that has many's opinion, not mine. I'm only giving you some information. Believe that those vaccines for the mRNA vaccines, Pfizer, Moderna, and there's like others that are mRNA types. You can do your own research on the many out there, but they are the issue. The DOJ put out a report. I couldn't find it in time for this show, but you might want to research it. I'm sorry, not the DOJ, the DOD, talking about the military. I already talked briefly about the miscarriages. Miscarriages has been a real thing to the point where some young ladies are having uncontrollable bleeding and can not have children any longer because the only way that stopped the uncontrollable bleeding that they found was a full miscarriage. I mean, a full hysterectomy. My bad. My apologies. Young boys having issues with getting an erection. Can you imagine being a young kid and you're not like 80 years old and you don't have any interest in it any longer. This is a young man. What is this all? Miscarriages and young boys not being able to have an erection. What do you think that slows the progress of having babies? Is this something that was intentional? I don't know. But that was one of the two things that were in that report that actually came out. Now, an unpublished Project Veritas recording reveals Pfizer scientists confirming the risk of mRNA vaccine COVID-19 claims side effects of these diseases or these vaccines are very sneaky. A former operative with the Project Veritas and O'Keefe Media Group, and a scientist previously involved in vaccine formulation at Pfizer, has brought to light unreleased recordings that raise serious questions about the pharmaceutical giant's development and promotion of the COVID-19 vaccines. Now, these recordings captured internal discussions among Pfizer top vaccine researchers, expressing grave concerns over the vaccine safety, efficacy, and the rush to market due to the pandemic emergency. I wanted to point out one thing. They did not follow the normal FDA protocol, which is animal studies, then human studies, and then release to the public. That's why it usually takes years for this type of for an actual vaccine to be able to be safe and effective, and everybody know that it's a safe and effective medication before releasing it to the public. But they stopped, and it never progressed to the human studies because all the animals died. Now, that study's out there as well, and you can find it at a couple different websites, but I couldn't find it for the show. I apologize for that. So what happened is, because of emergency reasons, human studies were not allowed. But guess what? With allowing it to be released to the public without even making it past the animal studies, you became, if you were someone who actually received the COVID vaccine, you became the study. And I'm sorry to hear that. Let's see. I do have something out of Florida. Florida Surgeon General confirms the dark secret about mRNA COVID-19 vaccines. There wasn't disclosed to the public when the COVID-19 shot rolled out. These vaccines are not appropriate to use in human beings. The Florida Surgeon General, Dr. Joseph Ladapo, declared in a statement calling for a complete halt to the mRNA COVID-19 vaccine. Issued this warning based on the overwhelming evidence that the COVID-19 shots that Pfizer and Moderna assured us were safe are contaminated with plasmid DNA. This wasn't disclosed to the public when the COVID-19 shots rolled out. In fact, the Pfizer COVID-19 vaccine injection into billions of arms was not the same one used in Pfizer clinical trials. There was a bait and switch. The human population received COVID-19 injections produced by Process 2, which Pfizer initial clinical trials tested vaccines manufactured by Process 1. The so-called vaccines rolled out to the human public, unlike the ones in the clinical trial, were contaminated with excessive amounts of DNA plasmids. The negative implications of such DNA contaminations are outstanding, as outlined in Dr. Ladapo. DNA interactions poses a unique and an elevated risk to human health and to the immunity of human genome, including the risk that DNA integrated into sperm or egg gametes could be passed into offspring of the mRNA vaccine COVID-19 recipient. If the risk of DNA integration has not been assessed for mRNA COVID-19 vaccines, these vaccines are not appropriate for use in for use in human beings. Now, Dr. Ladapo warned DNA integration could transform a healthy cell into a cancerous cell. DNA integration may result in chromosomal instability. Biodistribution of DNA vaccines and such integration could affect unintended parts of the body, including blood, heart, brain, liver, kidneys, bone marrow, ovaries, testes, lungs, draining lymph nodes, spleen, the site of administration, and subcutis of the injection site. This is what was said. I took the shot, now what? Luckily, there are a number of potential helpful therapies to detox from so-called vaccines. One of the best interventions in the incorporate daily supplemental nattokinase, an enzyme derived from the fermentation of soy. It has been traditionally used in Japan for its cardiovascular benefits. However, preclinical trial shows it degrades the harmful spike protein the COVID-19 shot instruct the cells to produce. Again, that is not something that I recommend. It's just part of this report. Do your own research before doing anything like that. Obviously, it looks like it's a pharmaceutical where you probably need a prescription anyways. So talk to your doctors. So Dr. Peter McCullough, one of the world's most renowned cardiologists and chief scientist officers of the Wellness Company, published the first ever spike detoxification protocol to appear in a U.S. medical journal. Dr. McCullough recommends using 2,000 fibrin units, 100 milligrams of nattokinase, orally twice a day without food. So again, look into look at information from your doctor and discuss it with them before doing anything like that. Here we are with 231 current and former U.S. service members demand military leaders be court-martialed over focused COVID vaccines. Service members were significantly harmed by these actions. Now, this was January 2024. 231 current and former service members from various branches of the United States Armed Forces came together to sign the Declaration of Military Accountability. This document, spearheaded by Commander Robert A. Greene Jr. of the U.S. Navy, marks a significant movement in military history, calling for sweeping reforms and accountability with the armed forces. Now, this letter was addressed to the military leaders, but was not addressed to the military leaders, but rather than the American people. The email was merely to inform these military leaders that there is a group of troops and vets pledging to the American public that we will do everything lawfully within our power to stop the willful destruction of our military by its own leadership. Let's take our country back in 2024 and let's begin to defending our military from its own leadership. You can find the body of the letter soon as we have in the website, where you can find it as well, along with the names of the 231 signatures. Let's see if I can find the email. If someone said they sent it to me, and I've been trying to find it. I don't have it. I apologize with that. We'll move on to the next one. Now, this is unprecedented injury to kill ratio. Thorpe reveals dangers of COVID-19 vaccines. On Monday, Dr. James Thorpe joined Ivory Hecker on a podcast, Beyond the Headlines, to discuss the discovery of DNA fragments in the mRNA COVID-19 vaccines and its impact on human DNA. Dr. James Thorpe, he says that the instinct possibility, this has been proven in vitro, meaning the laboratory, we haven't proven that as a solidly as we would like in real life humans, but certainly all of the machinery is there to reverse transcribe the synthetic deadly mRNA and the gene products to the human being. Having said, it's not too impressed that Dr. Lapato nor his attorney, Ashley Moody, nor with DeSantis, that they are days late and $1 short. The Attorney General, all three of them, have not responded to all of his communications over the last 2 years. And that's why they might have to do something now, but they dragged their feet. And I do believe it may have been intentional. I hope not. But Dennis Rancourt's data, one of the preeminent mathematicians and researchers in the world, he's clearly shown that this vaccine has killed 17 million people. The injury to kill ratio is 34.4. So globally, it's killed and injured 602 million people globally. In the United States, that would translate into approximately 700,000 Americans killed and about 2.5 million injured. Now, this is the unprecedented injury to kill ratio, really, in all medicine and really in military warfare. Another just crazy, shocking details. Now this one is, let me read you the description first. CDC concealed evidence linking deaths to Pfizer and Moderna COVID-19 vaccines. Internal documents revealed the U.S. Centers of Disease Control and Prevention officials found evidence that the Pfizer, BioNTech, and Moderna COVID vaccines caused multiple deaths before claiming that there were no evidence linked to the vaccines to any deaths. The U.S. public health regime and the bootlicking media have been routinely downplaying the risk of developing myocarditis after taking the vaccines, called to occurrence mild and rare, are systematically burying any evidence to the contrary. According to the documents obtained, CDC employees conducted investigations into reported post-vaccine deaths, particularly focused on cases involving myocarditis, a known side effect of the Pfizer, BioNTech, and Moderna COVID-19 vaccines. Their findings, spanning the end of 2021, highlighted instances where myocarditis was listed on death certificates and is autopsies for some individuals who have received the vaccines. In some cases, myocarditis was attributed directly to the vaccines. The files also shown instances where deaths met the CDC definition of myocarditis and symptoms appearing within 42 days of the vaccine and no virus-related symptoms present. Despite these findings, the CDC maintains that it has seen no signs linked to the Moderna and Pfizer vaccines. The VAERS, which contains information on unverified reports of adverse effects, illness, health problems, and other symptoms following immunization of the COVID-19 vaccines. Now, the CDC government website links to the VAERS platform, which, from what I understand, but I don't have a card stating that I have received the vaccine, 1, 2 boosters, however many you get. It's a card that actually shows that you've received these, and I believe it had dates and I think even a location of where you received them. Now, the VAERS website is a reporting agency of the government. Now, that is where you can actually go in and you could see individuals, and from what I understand, even doctors could go in and fill out the documentation about these issues, illnesses, health problems, and symptoms. And for a while there, it kept telling individuals that you didn't fill out the documentation correctly, or telling doctors that there's more documentation that's needed to fill out before it can be submitted. There was a lot of doctors stepping forward and talking about the VAERS website. So can you just imagine how many people don't even know about the website, but thousands of people are on there talking about it, saying, hey, after my, when I had the vaccine, this is what happened to me, which is a very small percentage, but there are thousands of people on there discussing it. And if you died, it would have to be a family member or a doctor. So if there's thousands on there, how many people are really being affected? That's my question. I know a lot of people that have had the vaccine, and most of them didn't even know about the website. And I said, check your card, and you'll see it right on the back of the card. You can find it on the government website. Now, what VAERS says, VAERS occasionally receives case reports from the U.S. manufacturers that were reported to the foreign subsidiaries under FDA regulations. If a manufacturer is notified of a foreign case report that describes an event that is both serious and unexpected, in other words, it does not appear in the product labeling, they are required to submit it to VAERS. Just thinking about how many people, it's not like I know thousands that have been affected of odd things, but I know quite a few. And it's more than I want to know. More people of having cancer is mind-boggling. 10 years ago, I might have known one person, 2 people maybe, that had cancer. But now, I work with a few hundred people. More than 1, more than 2, more than probably 10 have issues going on. Some have died. I don't know if it's linked to the COVID vaccine, but they're young individuals. Some say you don't even have to have the vaccine. If you had received COVID, then that could have caused blood clots. With the production of different things in your body, it caused all kinds of different things, especially lung issues. I know when I had an issue with breathing, and it was a very difficult time. I made it through, but was not going to get into anything with those vaccines. I mean, my research showed that medication I was on, it said, if you're on this medication, it's probable not to do anything. But it took me a long time to find a doctor, which I asked many. I have a pulmonary doctor that I deal with. I have for CPAP. I have a general doctor that I deal with, and when I was dealing with some foot issues, a few different doctors there where I needed a doctor's excuse to get back to work. And every once in a while, they would say, "Oh, did you get your vaccine?" And I'd say, "No, but if you can answer some questions." Okay, so with the medications I'm on, should I be affected if there's any kind of medication interaction with it? Oh no, there's nothing about it. I'm like, that's really odd, because even say aspirin, they tell you don't use this if you're taking aspirin. I mean, something as simple as aspirin, there's an effect of a certain other medication of why not to take it. But you're telling me something that's so new, and you know that, just like I do, that it's probable, but you're telling me there's nothing. So finally, I get to another pharmacy. I went to probably 3 or 4 of them. And the one lady says, hang on a minute. She goes to the refrigerator, pulls out one of the little boxes of vials, a brand new one. She opens it up, and she pulls out, there's a pamphlet inside. She unravels this thing, and it's tiny, but it unravels to 3 foot by 4 foot. It's huge. And the only print on that is that little tiny very beginning, before you even open it, of any kind of text. The rest of it is blank. And she's like, I don't know what this is, but they must have misprinted. I said, can I take that? Oh no, I can't give that to you. Why can't you give it to me? It should be public information. She just would not give it to me. So she goes on and she talks with the pharmacy and a couple other people, and they come up with 2 of the Pfizer and the Moderna. And she somehow comes up with information. And there's only a few concerns, but she did find that there were a few concerns with each one. And guess what? They were almost identical. They talked about, if you're breastfeeding, you should not take the vaccine. If you're planning on getting pregnant, or you are pregnant, it's a good idea not to get the vaccine. If you are on a blood thinner, you probably shouldn't get the vaccine. But they're not telling you not to get it. That was a shocking situation to me. Mind-blowing. That's the best I got right today. So you got anything to share, John? John, can you hear me?
I'm sorry, I had my mic off. Can you hear me now?
Yep.
Okay. I just wanted to share a short story. One of my neighbors, we have apartments next door. This was a few years back. Young gentleman, bright as can be. Really liked the guy. I really liked it. He's only there for 3 or 4 months, and we were becoming friends, and we talk about everything. So anyway, he worked for Johnson and Johnson. He was up for a promotion. The company was basically saying everyone in the company needed to receive the vaccination. he was the last one to get the vaccination. He really didn't want it. He didn't want to do it, but because he knew he was up for a promotion, he really liked his job. You know, uh, 2 weeks before Christmas, I guess he figured he had no choice. Christmas Eve, drives home to his family, his parents, and his brothers and sisters. They were all preparing food. Goes upstairs for a nap, and that was it.
Oh, I'm really sorry to hear that, John.
27-year-old man. Now, that's what I call reality. Okay, that's when we didn't know what was going on. That's when it was being forced on us, basically. That's when fear was put into us. That's when a lot of people took into all that fear. I don't want to get sick. I don't want to die. I don't want to make my family sick. I don't want to make
my job.
yeah, I don't want to lose my job, right? Why did they hang the job in front of you like a carrot? Vaccine or job? What's it going to be? Okay. So now, can you hear me good? I keep hearing something weird.
No, I can
Okay.
hear you fine.
Okay. Now we know the possibility that it changes your DNA. We know that it probably lowers your immune system. Seems almost like when you go get chemo for cancer, pretty much destroys all the good in you besides the bad.
Mm-hmm.
After all that you were just talking about, what about the right to use experimental drugs? They didn't want us to do that. What about the right to use off-label medications? Nah, they weren't having none of that.
No.
Okay. You know, we're past COVID and all that, but there's still a group of people that are buying into that. I still see people driving around in cars with masks, going into stores and shops with masks. Like, really? Why? At this point. If you call up your pharmacist and they put you on hold, I guarantee no matter what pharmacist you're calling and they put you on hold, you'll hear the schmeal. Oh, we got this vaccine, that vaccine, this vaccine, that vaccine. There's like 13, 14, 15, 17, whatever kinds of vaccines. Just come on in, we'll get them. And I'm thinking there's got to be people out there saying, hey, give me them all. Let me take them all.
That's crazy.
So in conclusion here, now that we have some awareness of this, be it right, wrong information, but we are aware of it, let's use some common sense, because I'm telling you something. They haven't stopped this. This will happen again. They will try to do some world event in the future, maybe sooner than we think, because we fell for that last one, hook, line, and sinker. Mask, stay at home, 6 feet apart, blah, blah, blah. Can't go to work. Well, stupid things could go, stupid businesses were allowed to be open. Let's learn from what happened and use our common sense. Because things are usually never as bad as they seem to be, especially if you got people pushing fear on you. We're going to take your livelihood if you don't do this. Now, me, myself, I'm here. I'm still alive. You know why? I'm a pure blood. I didn't take that crap. Wasn't even thinking about it. And my logic was, I already have things going on physically. Why would I want to introduce something else?
I
I'll
agree.
take I'll take my chances. I've always had a good immune system. I always healed quickly. I've always recovered quickly from anything throughout my life. And a lot of things happened to me in my life. So I know my body. So I'm not going to listen to no CDC or the WHO or people that ain't even in our government. Fauci, his science, any of that. Because they will try something like this again. It'll happen again in the future. And I just hope everyone's smart enough to just put the brakes on before you run and get a shot for something. That's all I got. But
Yeah, one of the things that is on a box of masks. It says it's one-time use, and you're supposed to wash your hands, take a mask, put it on. If you touch it again in any way, that is going to cause transfer of the any virus that you're trying to stop. So you, meaning the person wearing that mask, you touch it to pull it down, put it up, whatever, readjust it. You're causing more transfer than anything else. And that's why I believe they use that.
right.
Looking back at the Spanish flu, now they have reports that came out, and I believe it was from the NIH back in 2008. Again, check it out yourself, but this is my memory of it, where NIH came out and said people didn't die mostly because of the Spanish flu in 1918 was it, where it began? It was from bacterial pneumonia for wearing the masks.
Exactly.
It's just amazing how Fauci was like, they're probably thinking we don't have as many people dying of that. Maybe it was the material they were using back in the day that caused more people to die than they did now, or we haven't even just heard about it. Maybe we were just suppressed with the information about it happening now, a bacterial pneumonia. But back then, they were probably using something totally different
Right.
to keep them, to protect themselves from a virus.
Right.
But
And
this came out in 2008.
mhm. And the pushing of the mask basically slowed down herd
Immunity, yep.
immunity. So more people would have got sick, but it would have been a lot less violent, and the whole run of the virus would have been shorter if we were just allowed to get that herd immunity. But wearing the mask, so many people wearing the mask, the herd immunity was taking so long to happen because everyone was masked up.
That's just crazy.
Think about it, and think about what you were doing to yourself. You're breathing your own, waste air.
Yeah.
Over and over again.
Yep.
That must be good for the brain, huh?
Yeah, what was it? Carbon monoxide, carbon
Well,
dioxide, one of the two.
Well, yeah, because it's the law of the land. Trees produce oxygen, and they need what we exhale, carbon monoxide. So it's just the whole thing was crazy. I just hope we're smart enough, educated enough, and that whole follow the science, because I think science is a lot of lies in that science.
Oh yeah, they want us to hear the craziness and try to believe it.
So keep healthy, do whatever you can to eat well, best you can. Old remedies sometimes are way better than going and getting another pill. If you got if you got ailments, or you have like some really bad things, and you go on TV, you notice every other commercials about another drug. Then they get to that side effects, goes on and on and on, and sometimes they even say, or even death.
Yeah,
Ooh,
that's
I want
nuts.
I want to line up for that.
Yeah, where do I go? Do I just go right to my
Yeah,
local
yeah,
pharmacy? Gee,
yeah.
I'll take two.
Where can I line up for the death part of it? Stupid. It's really sad. And you wonder why our youth right now are absolutely, I don't know what's going on with that.
Brainwashed.
You know, they're brainwashed, supposedly educated. They're educated into stupidity. That's what they are. Useful idiots educated into stupidity. This whole week has been stupid, fake, made up, planned. And anyone who them that bought into it, or they're supposed to be our future, my God, the future's going to look pretty bad with people like that.
We just need a real leader, and I think we'll have a better direction.
Yes, exactly.
All right. Thank you for everybody for stopping in. John, will you want to hang out for a few seconds?
Sure will.
Don't forget to like, share, subscribe, and I hope to see you on future shows. Have a
Share
great day.
share the videos. Dan's
God
trying to
bless.
get his show up again. Let's help him out.
Thank you, John.